What adds to some impairments in outcome? Now, the frontliners usually for these kids and families are going to be the primary care physicians and also the pediatricians. To have referrals to like the tertiary centers where you can see the psychiatrist or the behavioral pediatrician. Again, it depends on which system of care you belong to, but usually, we're talking about the frontliners. Because ADHD is very diverse and sometimes the symptom presentation can be complex. It's not as simple as hyperactive, impulsive, inattentive. Sometimes you get these families, it's just like you feel like you're really struggling. And if you are a primary healthcare physician who doesn't have the tools or the skills in order to pick out and sort of triage and see which are the patients that are going to need more attention, more care, you're definitely going to have delays in the diagnosis and inadequate intervention. So this is just by logic. So it makes sense then, again, over the next 10 minutes or so, like every time we're going to be talking about a problem that we face, I'm just going to, throw out some possible solutions. So it makes sense that managed care organizations, they have to really intervene at a very basic level, which can start off with, education of the frontliners, because these are the ones that are going to be pooling all of the patients that we then need to keep following up. When you look at functional impairments, we also look at costs, because any individual in the society is there to be productive. We all want to be productive, and all families and parents of kids with ADHD, that is their goal. They want to have productive children, adolescents, and adults. So looking at costs, there's of course the direct costs related to the actual disorder, so treating ADHD and its comorbidities. And then you have indirect costs related to reduced productivity of that individual, and also their earning potential that's lost because they're either being kicked out of a job or changing jobs. So that is not a very productive individual. So indirectly it's going to cost the society. These are just the numbers, the amount of money that is lost. It's good if it goes into good cause, but if you feel like you could do more to save that money and provide better care, then I think that's where the goal is. But the annual cost of treatment for kids with ADHD goes from $2 to $11 billion. And the psychiatric comorbidities alone, they cost something like from $40 to about $90 billion, with alcohol abuse at the top of the list. Then with the functional impairments that kids will encounter, things that they pick up as they go along. So we know that kids with ADHD will start smoking at a younger age than those who are not. And again, the whole issue of substance use disorders, they are more likely to use substance if